Understanding Chronic Thromboembolic Pulmonary Hypertension, or CTEPH. For Steve, climbing up the stairs to his apartment feels like climbing Mount Everest. He is out of breath and tired. Sometimes his lips turn blue and he feels dizzy. Finally, Steve found out why. He suffers from CTEPH, a chronic disease that affects the lungs and the heart. The lungs and the heart are connected by pulmonary arteries. They transport blood from the heart to the lungs so that it is enriched with oxygen again. In CTEPH, branches of these arteries are blocked. The reason can be a history of pulmonary embolism, a blood clot in the lungs. If this barrier doesn't resolve completely, it might get attached to the vessel wall and transform into tissue over time. That occludes the arteries. The heart tries to work against the increasing pressure. Due to the high amount of stress, the right side of the heart becomes larger and weaker over time. This is why patients like Steve get out of breath easily. To describe the medical condition and the severity of CTEPH, a PH healthcare professional assigns a patient to what's called a WHO functional class. That helps the healthcare team to better understand how CTEPH is affecting the patient. In Functional Class 1, CTEPH patients have no symptoms during ordinary activities or at rest. In Functional Class 2, patients are comfortable at rest, but ordinary activities, such as climbing a flight of stairs, grocery shopping, or making the bed, result in dyspnea or chest pain. In contrast, patients in Functional Class 3 may not have symptoms at rest, but any activity is greatly limited by shortness of breath, fatigue, or near fainting. Patients in this class have to take breaks while doing daily life activities. Patients in Functional Class 4 even have PH symptoms at rest, which increase with any kind of physical activity. Like anyone else, a CTEPH patient has good and bad days. The functional class describes their overall condition, independent of how they are doing on a particular day. As CTEPH is potentially curable by surgery, it is important to diagnose as early as possible and to distinguish CTEPH from PAH with special tests like a VQ scan. For Steve, dealing with the diagnosis was tough at first, but he finds support in a CTEPH specialist. The specialist explains to Steve that CTEPH is the only type of PH that can potentially be cured with surgery. This surgery is only possible for patients that have the blockage very close to the heart so that it can be accessed from outside. If he has residual or recurrent disease after the surgery or is considered inoperable, he can receive pharmacologic treatment. Steve also receives excellent support in his patient organization. They provide him with a lot of information about the disease, help him to find a PH specialist near where he lives, put him in touch with experts if he wants psychological counseling, and give him a chance to exchange experiences with other patients. Knowledge is the first step. Talk to your CTEPH specialist and find out more at phaeurope.org.